Today, the guests on Tillamook today are from our great, wonderful hospital that we have in town, and we have Cherie and Melody. Welcome, ladies. How are you?
Oh, great. Thank you.
Thank you.
Thanks for being here today. We've got a good show for you lined up, and we're going to be talking everything health-related and all the activities that the hospital has to offer and programs. And, you know, I personally love Adventist Health. All my kids were born there, had great experiences. And if you've ever been a patient there, and if you've talked to me, the milkshakes are my favorite thing.
I was going to ask if you were going to bring up the milkshakes again.
Absolutely. The milkshakes are the greatest thing. And if you haven't, well, there we go. I got it. If you have stayed as a patient, you probably know what I'm talking about. And if you haven't and you go stay as a patient, make sure you get a milkshake because they are
as long
fantastic.
as you're not on a diabetic diet. You
as long-
might
okay.
have to be careful if you're on
Caveat.
some diets. Yes.
That's true. But, great experience, great offerings at our hospital. And we're going to talk a little bit about all the things that we've got going on. Because you guys do more than just, you're more than just a hospital. You do classes. And let's talk about some news and classes and urgent care stuff that's going on. There's just lots of stuff going on with the hospital.
Well, Kaylan, I remember back in 2013 when we first opened urgent care, and it was such a great thing for our community, and we were so excited to be able to offer that. But we only had it for certain days of the week, and as of June 1, here in Tillamook at the Plaza, we have urgent care open 7 days a week.
Wow, that's fantastic.
Because I know you've got kids. I used to have a small kid, and for some reason, those ear infections, they come on like Friday, just after the doctor's office is closed.
Yeah.
And you're trying to call an answering service. You're trying to say, yes, I need an antibiotic to get through the weekend. Now we've got urgent care 7 days a week.
That's
and
great.
it can handle those things that come up, that rash, that sore throat, the strains, sprains. Now, I did see on the list here, broken bones, but not if the bone's sticking out of the skin.
Then you want to go to the ER.
Yeah, there's a time to go to ER. And if you have shortness of breath, if you've got chest pain and you're pretty sure it's not from that indigestion you ate, but even if you're not quite sure it's from indigestion, if you've got one-sided weakness, one side of your face is drooping, or you can't use your right arm, but the way you can use your left arm, blurred vision, those are some of the things you still need to go to ER for.
Right.
And obviously, if you're in a car accident or something really bad happens, the ambulance service will bring you to the emergency department. And so what we're trying to do is have that emergency department be able to take care of those true emergencies, and then have urgent care available for those other things that you used to have to go to the emergency department for. But these days, your insurance doesn't like to pay for that so much. And if you have a deductible or an out-of-pocket part of that, you're not going to want to pay for that either.
Right.
So urgent care really meets the need for those lower-level things that pop up and doesn't do quite such a number on your pocketbook. So we are delighted to have it open 7 days a week at Tillamook Medical Plaza. And then as of July 1, we will also be open 7 days a week up in Manzanita.
Oh, wow. That's just fantastic that you are making such an effort as an organization to be a part of our community and make sure that everybody's taken care of it. And, that takes away that, I'm going into the weekend and I'm uncomfortable and I just really want to see somebody, but I don't feel like it's an emergency room visit, but I'd really like to feel better. Now there's an option for that. And that's great. That's fantastic.
Well, and the other thing, too, is if you've got chest pain and you weren't sure, oh, shoot, did I put too much, ketchup or mustard or hot sauce on that thing? And did I get indigestion or could it be a heart attack? If you go to urgent care, they can really fast track you into ER. If they say, no, we think you're having a heart attack, you should go to the emergency department. And especially with how far away our different communities are from the hospital, and the fact that if you're having some of these health issues, we need to get you to Portland as fast as we can.
Right, yeah.
And so we're able to make that system work.
Yeah, and a lot of people don't realize how fortunate we are to have a critical access hospital right here. And is that critical access? Is that
yes,
the right
it
terminology?
is. Yes,
perfect.
You're on
I'm
it.
listening.
Yes.
I've been asked to serve on the civic advisory board, so I get to see a lot of behind the scenes and what's going on with our hospital and see the impacts that that we're having on our community, and it's just great. The things there's a sports wellness event coming up, and you want to talk a little bit about that?
Absolutely. Do you want to do that?
Oh, sorry.
Okay, go for it.
About urgent care, because we travel so much in our community, from up and down the coast, from Manzanita to Lincoln City, even over to the Banks area. I was over there yesterday driving on Highway 26, and we know that's a dangerous drive if you're not alert. I love the fact that even our Banks office will be open on July 1 for urgent care on Saturdays from 10 to 6. So you've got Manzanita 10 to 6, July 1st, and Banks 10 to 6. So if no matter where you're traveling in our region, 71 miles of the Oregon coast, we've got it covered. And it's nice to know that if you start driving and you're not feeling well, you can stop in at one of our clinics. That's pretty cool.
Yeah, I actually saw a billboard for Adventist Health when I was coming back from California last weekend, and I was like, oh, look at that. That's just so great, because you just feel at home. It's great. So the sports wellness event that's coming up.
Sports
give us some
wellness.
details
We're
on
doing,
that.
well, it's a big word, it says on the flyers, adolescent well checks and sports physical event. Basically, you can get your school sports checks done. You can get your well child checks for everything from your children on up to your teenagers. And you can get that in 3 locations. We've got that starting on July 22. Again, at a number of different locations. We've got July 22 in Manzanita, July 31 here in Tillamook at Women's and Family Health, and July 23 in Pacific City. And so just call the main scheduling number, 2292. That's what we do internally. 815-2292. Let's try that for those of you at home. And then you can just say, I want the well child check, the sports physical, and we can help take care of that for you. And this is something we've been doing for a while. Appointments are preferred, but they'll take walk-ins, ages 12 to 21. And there's no out-of-pocket costs on this.
Wow.
We want to make sure that our kids are ready for school.
Yeah.
And you don't want to be wait until August when it's fair time and other stuff going on, and then you're like, oh gee, we got to get that done. You can take care of that at the end of July and just have that check marked off for the year and be done with it. They're going to have some fun food and prize drawings there too. So. And
you said that's zero cost.
Zero out of pocket.
Wow, that's great.
Yeah.
And the times are convenient too. It's 3 p.m. to 8 p.m. At each of those locations on the 27th.
Oh, so it's like after work time.
Yeah.
So it makes it easy for you to be able to take your kids in after work.
So watch for the ads. I'm sure we're giving you lots of ads on your Facebook feed as well about that, to be able to have you remember that. There's so many different channels we use to communicate with people. And one of the other things too, so going from the kiddos and the young people and the whatever I'm supposed to be saying to our older folks. And 1 in 3 Americans age 65 and older falls every year.
Oh, wow.
They fall. And
wow.
that's not good. There's a lot of things that can happen when you fall. And so over at the Medical Plaza, they have a free class that is helping you to stay healthy and independent, preventing falls. And you'll get what are some reasons that you fall? Maybe your medication is giving some problems for your balance. Are there exercises you could do? Are there exercises you could do at the Y, perhaps?
Believe it or not, I was going to mention that we do have Tai Chi Moving for Better Balance, which would go right in this. And if you're a senior, that's an absolutely free class. So you don't have to have a Y membership to come to our Tai Chi classes or our enhanced fitness classes if you're a senior. So.
Oh wow, I didn't know that. How old do you have to be a senior? 65
and over.
Oh shoot, I'm not there yet.
No,
okay,
you don't look anywhere. You don't look anywhere close, Nellie.
So take advantage of community exercises. They'll teach you some you can do at home if you don't make it as far as the Y. Sometimes what you wear, the shoes that you wear. I've got one pair of shoes and I work in an office, but they catch on the floor.
Right.
And I've about pitched down the stairs a couple of times. Don't tell the risk manager that. And so there's just some things that we can be aware of. So the next class is coming up in July. And so watch for ads on that. You can always call the hospital and just ask for information about any of our classes. And we're happy to help people live healthy.
And most of your classes are free, right? Like probably 99% of the things I've seen you guys offer are free. And that's, I think it speaks highly of the care that Adventist Health puts out. That you guys don't want to see our community members in your hospital, and that's great. Other than for classes, that's the job security, cool? Right?
Yeah. Wouldn't that be cool? They all went to the Y and exercise. They only came to us for their immunizations and the easy stuff, But the thing is that we're there for you.
Right. Absolutely.
When you need us, we are there. We are in the communities with that frontline clinic care, but we are here with the best possible care. If you need an ICU, if you need a surgery,
right.
If you need some of the things that we can do here, we do very well, and we take it seriously that we do it with good quality.
Yes, you do. Yeah.
And if we can't do it here, we'll make sure you get connected with the best possible care in Portland as well.
Right, and that's another thing that I do love. We've had to be. My son had he had appendicitis, and he was 13 months old or 21 months old. I can't remember, but
appendicitis.
It was terrible. But there was no pride on the table, and the doctors immediately said we're gonna end up sending you. And there's this fear as a parent, and even as an individual, that the person sitting across from you is going to have this pride that they're going to have to fix you, and they don't want to send you on. And I don't feel that at our hospital here, where they look at it and they say, hey, you might. We're going to send you on because we feel they might be better prepared to handle your case. And I love that. And I've seen that, and I've heard stories about it. And that speaks volumes to the credibility as medical associates that you have in your building, that they're willing to put that pride aside and say, hey, we want to send you to wherever you're going to get the best care possible. So
absolutely.
So that's great. And you guys are doing other great things. Yep. You've got some gifts and grants that came in. You're going to working on the opioid response program. You want to talk a little bit about that?
Addictions, as we all look around in our community and we see folks struggling with addictions. And so as a committee of our governing board at Adventist Health, Tillamook has been working on this and saying, what can we do as a hospital? How can we bring together the community around addictions response? And an opportunity came up, and we actually were funded for a $200,000 grant from HRSA to formalize a consortium of local partners to create a strategic plan to address substance use disorder, which includes opioid use disorder. Dr. Rex Parsons is a member of the committee from the governing board, and he's very clear that addictions pathways are all the same. Whether you're focused on opioid or you're focused on meth or you're focused on something else, that pathway to addiction and that pathway to recovery is very similar. And so we're looking addictions, but looking at it through right now the opioid lens and using funding that's available for that. We've got some great community partners that are coming together to work on that. Tillamook County Community Health Centers, the Reinhardt Clinic, Tillamook County Office of the Sheriff, Tillamook Family Counseling and Care. And the next steps you'll be hearing more about over the next 12 months as we create the plans and then choose some things to implement. What are some things we're going to test? How can we make this better in our community? Also, a number of folks who are listening may have gotten a letter from us about a vision screening initiative. Several of our clinics are more than 20 miles away from the nearest eye care professional. And so having a vision spot screening unit that you can just go zap, and as young as 6 months of age, you can find out if that kiddo has any vision issues that the family should be seeking help for earlier rather than wait till they get to school and wonder why they can't read. That is something that we're able to do for that. That way you're not like making the trip to that faraway place with your kids and even trying to make an appointment.
Is that the same as the diabetic eye screening?
No,
or is that
it's a different unit.
Okay, different
so
unit.
The retina views are looking specifically at your retina to look for disease process.
Okay.
The spot screening is looking to see, are you nearsighted? Are you farsighted? Do you have some other...
Dropping stuff in the studio here, sorry.
Yeah. Do you have... is there some other issues that are impacting your ability to see well? And oftentimes kids are pretty good at faking it, or they just assume because they've never been able to see well, that's the way things are.
They just adapt.
Yeah,
They adapt
do.
to whatever.
They're so resilient. So we're looking to have these spot screening units in 4 clinics, and we were just really grateful to Oregon Community Foundation for $17,000 in funding.
Wow.
We're now going back to Ford Family Foundation to ask for 10, and just with a little bit more, we'll be topped off and be implementing this project.
Wow. Man, doing so much.
Yeah.
And then to kind of top it all off, you're doing the golf tournament to benefit the ambulance services,
Yep.
correct?
And that'll be September 24, and so we'll be getting more information out about that.
Fantastic.
And I think you're supposed to read a whole bunch of stuff now about...
I'm supposed to, yeah. Cherie, do you have anything to add to all the stuff that's going on?
I think that Melody's doing a great job. She's talked about all the awesome things we have going on. So
because you jumped in the marketing position, correct? Is that
I did. I'm now the manager of marketing and communications for the hospital and also the clinics here on the coast, as well as a few clinics on the east side. So I'm really excited about the role, and this has been a lot of fun.
Awesome. Well, I appreciate you reached out to us, and you guys are helping sponsor the milk run that's tomorrow. So you guys are been great partners to the Y. You helped build our pool. You're helping currently fund our pool and the milk run and just so much more. And I know you do so much in the community. We are going to take a quick break. Today's Tillamook Today is brought to you by Rosenberg Builder Supply. Where do you go to find almost anything you need for home improvement? I'll tell you where. Rosenberg's. Rosenberg's has your local connection for anything you need to build and finish your house to perfection. Carpet, cabinets, paint, electrical, plumbing, nuts and bolts, fencing, windows, doors, and so much more. All those items in one place. But that's only part of the story. What really makes Rosenberg's your stop for home improvement is their people. Their knowledgeable, friendly staff is there to help you through any project. Any question from what paint you should use to how to install a new shower valve, you can get the help you need and do it right the first time. Stop by Rosenberg's today to rediscover what you've known all along. It's better to shop local and work with great people that you see every day. Build it, plumb it, wire it, paint it. Rosenberg Builder Supply in Tillamook. And that's let's see what else we got. And I skipped birthdays. So when I step in for someone, I'm kind of all over the place. I'm so excited to be back on the radio, but I only have one birthday on my list, and it's Rob Trost. So if you know Rob, give him a call, say happy birthday, and we'll go from there. All right. So a little bit other things that are going on, and so June 13, 2019, Adventist Health Medical Plaza Urgent Care is now open on Saturdays, which is what Melody just mentioned. And the expansion of Saturday access to urgent care means quicker treatment options for your family. We just talked about that. So if you're just tuning in, the urgent care clinics are going to be opening 7 days a week, which is going to be fantastic. And the hours are going to be, for the urgent care, 8 a.m. to 8 p.m., so really long hours. And then Saturday and Sunday and holidays would be 10 a.m. until 6 p.m. So great news coming from Adventist Health, and we're excited to hear that, hear those programs. So we also have some Faith in Action and Wellspring information that we were gonna share.
Well, I think as we look around our community, if you're sitting in church or you're sitting at any other group that meets, you're beginning to see the aging of our population. And while Kaylan's doing his best to bring on the younger generation, we do have a lot of older folks. And nationally and locally, the number of people over age 65 is growing and expected to double in the next 20 years.
Wow.
Yeah, I can't imagine that. Of course, I'm going to be in that group in the next 20 years, so I'll be able to get my Y discount.
There you go.
Yeah. But unfortunately, with older age, you have more complex health situations. You can be on some of those heart medications, some of the other medications that impact your balance. You can have arthritis that impacts your ability to move. There's increased frailty, less muscle mass. Now, you do see some pretty buff older people that are obviously going to the Y, but you just generally see people a bit more frail. And unfortunately, dementia. I had no idea until recently how many different kinds of dementia there are. And so with that, a person may no longer be able to fully care for themselves, and they may need some help. Now, sometimes if that's grandpa, grandma's there in the house taking care of him, or the other way around. Sometimes we have older people who they are all alone in their home here. And for example, a 90-year-old person will have a 70-year-old child, so to speak, who is still trying to care for them. In my situation, I have a mother in North Idaho who's aging, and I have a daughter who's just graduated college. So I'm in that sandwich generation. Mm-hmm. I'm dealing with things with my daughter, dealing with things with my mother. And so we all have different ways that we caregive and that we try to step in and help our family and our neighbors. And I think the hospital, a number of years back, joined with the Robert Wood Johnson Foundation and opened a Faith in Action program. And so this is volunteers who do one of two things. There's home-based, where we recruit and train and deploy volunteers to go visit. There's friendly visiting once a week. Do you need a ride to the grocery store? Well, you probably could get Dial-A-Ride, but it can be kind of complicated to do that. You could get a friend, but what if they can't make it? And so volunteers can come in and they can take people to the grocery store, do local transportation, do some light housework where they're not there to do your spring cleaning, but they can help you, finish up those, get the dishes washed. They can help you get that heavy trash can out. They can do things like that. For example, one volunteer, there was a 90-year-old lady who was living alone, and he would come every week and carry in enough pellet bags and put them by the pellet stove so she could stay warm in the wintertime. And, you get to that age, there might be some that could do it, but to have those, I can barely lift those bags. Maybe I need to go to the Y. So we have a number of supports through Faith in Action in the in-home services. The other program that we have is Wellspring, and that is a 6-hour program that is held in the fellowship hall at the Adventist Church, and they have an amazing time together. And these are for folks who need that full-time care. This gives the caregiver a break. Right. You can drop grandpa or grandma or, whoever. You can drop them off at Wellspring and they are going to be loved on. There's a nurse there that can take care of medications and personal care. There are volunteers that'll help them do anything they need to do. There's people that will listen to their stories. They have not heard their stories before the way that we've heard our loved ones' stories. And so they have crafts, they play bingo, they have a sing-along, music sing-along, they have snacks, and I'm thinking, okay, how old do you have to be in Wellspring?
Yeah, that sounds great.
But it's a great break for the caregiver because they come and they drop off their loved one. We take care of them with great care, and then they can go do whatever. If they need to go get their hair done, go get the groceries done, if they even just need to go back and sit in their easy chair and have a quiet time alone.
Just read a book or...
Yeah. And so
and it's really affordable.
It's affordable. $30 a day. It's for 6 hours of respite care. For those folks who can't afford it, we do have some generous donors who make sure that we can give financial assistance. Right. Families are kind of reluctant. It feels like if you take your loved one to Wellspring, maybe it's because you're not doing a good job or they might not take care of them as well as you do, but I can tell you, they take good care. They are so loving. The volunteers that are there are so loving. Carolyn Betlinski is our Wellspring nurse, and if anyone knows Carolyn, she personifies love.
Right, yeah.
And so I would just encourage anyone who has a loved one who is just that 24/7 caregiving, and to be able to just call into the hospital, ask for Faith in Action, and just ask some questions. Let us get started. Come visit us. We'll arrange for a time you can come visit and you can see what it's all about. Because, boy, if my mom was here and not in North Idaho, I would have her signed up.
Well,
I would
it's
totally.
So valuable. Anybody who's done any caregiving for any age person knows that little bit of respite that you can get so that you can be a better caregiver by pouring back into yourself. I mean, that's huge. So it's a great partnership, or a great program there. And, I'm sitting in Stacy's chair today, so I think I need to mention Northwest Senior Disability Services. I know you guys partner
They're
a lot.
They're a huge partner with us,
and they have caregiver support. So if you are a caregiver, make sure you reach out to Northwest Senior Disability Services, because they have support there as well.
And they have some funds that can help pay for this as
Absolutely.
well. And there's a caregiver support group. There's all kinds of information. Reach out to the senior services. Just call the main number at the hospital and ask for Faith in Action or Senior Services, and we'll be happy to help. We are here to help you, and you do not have to do it alone.
Yeah, I think there's so many resources in this community. There's over 100 nonprofits. So if you're doing something in your life and you're thinking, man, this is hard right now, reach out, whatever it is, because the odds are there's somebody out there who's going to be able to help you out. We're closing in on the end of our show. Wow, this time flew by. You guys are great guests, and the hospital's just doing so much. I don't know. And there's so much more.
We could probably talk for an hour, but we don't have an hour.
I know they'll kick me out. They'll actually just push the buttons and shut me down is what they'll do. Or I'll push the button and shut myself down, apparently on accident. But so a couple other things before we close out. Monday on Tillamook Today, Senator Betsy Johnson is scheduled. She is going to have to miss our parade tomorrow due to some continued work in Salem regarding what's going on in 2020. So I'm glad she's there working hard for us. Great representative for our area, or senator. She's representing our area as a senator, not a representative, but you know what I'm saying. Senior meals, speaking of seniors, 11:30 a.m. at St. Mary's by the Sea in Rockaway Beach every Monday, Wednesday, and Friday, and at noon every weekday at the Kiwanda Community Center in Pacific City, as well as the Tillamook Senior Center at 4th and Stillwell. Cost is $3 for seniors, $6.75 for everyone else. Tapa's newest comedy closes this weekend. It's The Odd Couple. It's the female version. Runs today and tomorrow at 7 and Sunday at 2 o'clock. Tickets available at tillamooktheater.com or by calling 812-0275. Make sure you get out there and watch the show. It's great. And the rodeo is this weekend. So if you tuned in a little earlier, it was this week. Earlier this week, the rodeo queens were here on Tillamook today, and they're going to be putting on a show out at the fairgrounds. Tomorrow, it's today and tomorrow. Gates open at 4, and they start rodeoing at 7. Tomorrow's Kids Day. Kids get in free with an adult. So adults, make sure you take your kiddos out there for some free entertainment. So basically tomorrow, if you come to me on next week and say I was bored this weekend, I don't want to hear it, because there's so much going on. Starting early in the morning, we got the milk run, and then right after the milk run, the parade starts at 11 with the new-ish route. And the Swiss Hall is hosting lunch after the parade, so swarm the Swiss Hall and get some lunch. Farmers markets, lots going on. We got farmers markets, Manzanita Farmers Market 5 to 8 Friday on Laneda Avenue. Nescoin Farmers Market Saturdays 9 to 1 at Nescoin Wayside. The Tillamook Farmers Market Saturday 9 to 2 between the courthouse and City Hall. And Pacific City Farmers Market Sunday 10 to 2 at the PC Library. Also, don't forget. Oh wait, this was last week's note. I was gonna say Father's Day is Sunday, but that was last Sunday. But you know what? It's
every day is Father's Day, right?
Every day is Father's Day. Every day is Mother's Day. Every day is Kids Day. So find someone you love, give them a hug, tell them you love them, and that's all. Thank you so much, Melody and Cherie, for joining me from Adventist Health. Is there anything else you want to throw out there? Now's your time.
Thank you.
Yeah, be healthy and call us if you have any questions.
And again, urgent care is going to be open 7 days a week now, so don't go through the weekends being uncomfortable. Just go get checked out at the urgent care clinics. That's all for me today. I'm going to push some buttons and get myself out of here.